All right, thank you all for being here this evening. And we are focusing on the low back today. So if you have an injury of the low back, if that's a place where you tend to get injured, or if you would like to prevent injury of the low back, or you're currently having some problem with the low back, this would be a good practice. But it's couched in a overall practice. So even if you don't have issues with your lower back, I believe you'll get something out of the practice today. As far as the props, we need a chair, we will just be resting our legs on the chair. So if you're near a couch or an ottoman, that will work for our purposes today. 2 blocks if you have them. If you don't, it's fine. You can get by without them. Strap will be for stretching the quads if you need it to reach back and find the foot. And we need a blanket or a towel for the practice today. So just a reminder that, especially since coming from the survey, it looks like most of you are here for injury prevention, athletic recovery, listening to your body. It would be a shame if you injured yourself doing yoga. So nothing should be painful or uncomfortable. If you're dealing with an injury, be mindful of that and modify, adapt, rest, substitute, do whatever you need to do to be protective of what's going on with your body, your energy level, or whatever might be impacting your practice today. We're going to start in a relaxation position, which will be legs up on the chair. So we're lying on our backs. We're having our calves resting on the chair. So just situating yourself here, and depending on the depth of the seat, your knees might be way out to the side, or they might just be gently rolled out to the side. And it's okay to let them. So you're not trying to keep the knees in line with the hips here. It's really about just the bend in the hips and the knees in this position. So once you get yourself comfortable, if it feels good, close the eyes, but you don't have to. Begin to bring your attention to your breath. Feeling the belly and chest, expanding on inhale, contracting on exhale. And breathing in and out through the nose. Letting the legs rest here. So you're not really trying to engage anything or hold a position. The earth and the chair are holding you here. The benefits of this position are because the spine is parallel to the earth, we're actually decompressing the spine, meaning instead of gravity compressing downward through the vertebrae, through the discs, we're creating space between the vertebrae. So the discs, those that are in between the vertebrae, can actually expand. And one of their main jobs is as a shock absorber. So the disc itself should have some fluid in it. When we decompress the spine, those discs can actually imbibe, they can pull in more fluid. So they act as better shock absorbers. The hip position is putting the hip flexors into a slackened place so they cannot pull on the lower back. You have 5 hip flexors on each hip. 3 of them come up and attach to the front hip bone, which is actually part of your pelvis. 2 of them go deep behind the lower abdominal organs, and 1 attaches to the bottom 6 vertebrae of your spine, which are psoas. This position, those muscles are all in slack, so they cannot pull on the lower back. So this is often a position when I feel fatigue or pain in my lower back, I come in to get some relief. Take the next few breaths and set an intention for your practice. And it could be very simple, staying present, with the sensations in your body, perhaps even more elemental or basic, just staying with the breath. You might have another intention for the practice today. Bring this thought to the front of your mind and breathe with intention. We're going to take our legs off of the chair, and it might be you just scoot back away from the chair. We're sitting up and moving that out of the way. We're coming onto our backs again with the knees bent and the feet flat. And we're going to do some forward and backward pelvic tilts. We've done that backward one here before in recent times. So we're exhaling to flatten the lower back into the floor, tipping the tailbone up without lifting the hips, and go in the opposite direction. We inhale, press the tailbone into the floor and arch the back. So it's lifting away from the surface. We go back and forth with this. Exhale, flattening the lower back, tipping the tailbone towards the ceiling. Inhaling, arching the back, tailbone pressing into the floor. Go back and forth here a few times. And you may have some stiffness or tightness, or there may be parts of this motion that don't feel good to you. You could always limit your range of motion, especially if it's painful. If it's stiff or tight, you're just moving in whatever comfortable range of motion that you have. We're starting to move that lumbar spine in the forward and backward motion, just similar to cat and cow that we do from hands and knees, but here is more limited to the lumbar spine, the low back, and the pelvis. On your next inhale, just allowing this to relax and release, and pause here for a moment. We're getting ready to work the core, but I want you to notice the pressure or where the back ribs make contact with the floor and where the back of the pelvis, the back of the hips make contact with the floor. Because we're lifting the legs up here, knees bent. Press those areas that are touching the floor, press them more into the floor. So the back ribs press into the floor, the back of the pelvis presses into the floor, and you'll feel your core engage. So these abdominal muscles, innermost layer, wrapping around the torso, and they're the ones that support the spine and the pelvis. So starting simple, keep the back ribs, back of the pelvis touching the floor, not rocking away. Lower one heel and raise it back up. And alternating legs, inhale, lower the other heel, and exhale, raise it back up. So inhale to lower the foot, exhale to lift it to the starting position. So you're trying not to do that arching and flattening of the lower back, keeping this relatively neutral spine position, and that's with the innermost layer of abdominal muscles. So you could keep it at just legs. If you'd like to add arms, which will add a little challenge, as you lower one foot, the opposite arm is going to reach overhead, and then we exhale, pull it back up to the starting position, and alternating legs here and arms. So it's opposite arm and leg moving, keeping the back ribs, the back of the pelvis pressing into the floor. If you're tight through the lats, so this might be an area, it's a common area of tightness in rowers. Lowering the arm might make you want to flare your rib cage, like arch it towards the ceiling, but keep it pressed down. All right, we'll pause here, pull the knees in towards you. You might hold shins, or if you have knee issues, hold the backs of the thighs instead, and just gently rock. So those core exercises where we work the transverse abdominis, that innermost layer of abdominal muscle, where it's really just bracing the core, are really one of the most important muscles for stabilizing the spine and also decompressing it when we're in upright positions. We'll bring those knees back in through center, lower one foot to the floor, and hold on to the back of the other thigh. Let the elbows straighten, so you're not pulling the knee in close to you. We're coming into a sciatic nerve glide. So as you inhale, start to straighten that knee. Pull the top of the foot back towards you, so you feel kind of a stretch or a tug down the back of the leg. And then let the knee bend and the foot relax. So we inhale, start to straighten the knee, pull the top of the foot towards your shin, and then exhale, let the knee bend, the foot relax. And we'll do a few more here. And you're not going to an extreme or really uncomfortable or painful stretch position. Straighten the knee, pull the foot back just enough. You feel that tug or stretch that goes down the back of the leg to the calf, and then you feel it into the heel a little bit. And then we'll let that leg go, switching sides, holding the back of the thigh, keep the elbows straight. Inhale, start to straighten the knee, pull the top of the foot towards your shin, and then exhale, release. So release meaning bend the knee, relax the foot. Keep holding onto the back of the thigh. The sciatic nerve is biggest nerve, maybe the kind of fattest, biggest diameter nerve in the body. Starts in the buttocks, goes down the back of the leg to the foot. And there's some areas along the way where it can get entrapped, including muscles on the back of the hip, and can cause nerve pain down the leg. This movement is starting to loosen up areas where it might be bound down, stuck with connective tissue. We'll lower that foot back down to the floor and rolling over. We're coming up onto hands and knees. We're going to be weight bearing through the knees for the next several poses. You might want that folded blanket under the knees just for comfort reasons. Knees under hips, wrists under shoulders. Remember some options. I know rowers have a tendency to be tight in the forearms and the wrists. Sometimes that 90-degree angle at the wrist doesn't feel great. You could be on loose fist instead of flat palms. You could be on your forearms, elbows under shoulders instead of that weight-bearing position through the hands. Cat and cow. Exhale, round the back. Tuck the chin, tuck the tailbone under. Inhale, lift the tailbone, pull the chest forward. So we exhale, round the back, pushing the floor away, belly button towards spine. Inhaling, arching the back downward, chest pulling forward. And back and forth here a few more times. Moving in a comfortable range of motion as opposed to trying to force. I think most people's tendency is thinking if something is tight, if I stretch the heck out of it, I'm going to get to the other side of the tightness. And really, sometimes it just injures you more or even makes you tighter because your body is resisting the painful movements, which is sort of a natural reflexive reaction. We're bringing it back in through center, that neutral spine of tabletop. And from here, we're sitting back into either a child's or puppy pose. So child's pose is hips over heels, forehead resting. Puppy is hips over knees, forehead resting on the floor or stacked hands. And the reason I give the option of puppy pose instead of just doing child's pose is that if you have a herniated disc in your lower back, child's pose, that kind of rounding of the lower back can make a herniated disc worse, can make it herniate more. If you have osteoporosis or even osteopenia in the spine, that compressive position of the spine can actually cause a compression fracture. So those are reasons to do the puppy pose instead of the child's pose. And maybe you're just really tight in the low back or the knees or the hips, and the puppy pose works better for you. Either of these poses, the hip flexors are slackened here as well. And so that might be a little relief to the lower back too. That's, I think, a lot of reasons or times why child's or puppy pose feels good to the lower back. We're going to do a little side stretch from here. So lift the head and walk the arms over to one side and stretch the arm across. So I walked my torso over to the left and reaching out through my right arm. Let the forehead rest down on the floor or the hand or just a loose fist here. We'll hold this position, but notice the movement of the breath here. So as you breathe in, the rib cage expanding, maybe giving you a little more stretch as you breathe out, releasing. Take a couple more breaths and using the breath as the mobility piece in this somewhat static stretch. We're going to lift up and walk it over to the other side. Stretch out through that one arm. That's going to get the lats stretching here. And maybe you feel this in the side low back as well. Some of those low back muscles just to the side of the spine can be hard to stretch sometimes. This is one way to get to them. I'm going to walk this all back in through center, coming up to the hands and knees here again. And we're coming into one leg back, toes tucked under. We're going to do this little toe rocking movement. So you inhale, shift forward, bend through the toe joints. Exhale, press the heel back to stretch through the calf. And forward and back here a few times. So I often use this here before going into a deeper calf stretch like down dog, mobilizing the joints of the ankle, big toe, moving the connective tissue around the calf, sole of the foot, that plantar fascia. I'll lower this knee and switch sides. And the fascia is connective tissue. It's another name for connective tissue in the body. And unlike the muscles that start and end on specific bony attachments, the fascia really runs continuously through the body. So even stretching the calf, stretching the sole of the foot can actually loosen up fascia or tighten down connective tissue at the lower back. We're lowering this knee back down. So I'm setting up here for a down dog. Down dog can be a challenging pose. Keep in mind that puppy pose is sort of like a kneeling down dog, so that might be an alternative for you. Down dog, hands a little forward of shoulders, fingers spread. Tuck the toes and reach the hips up and back. Now prioritize lengthening of the spine. So if you're tight to the backs of the legs and the back is rounding, bend the knees, push the sitting bones up and back. Relax the head between the arms and pedal the feet. Bend one knee and straighten the other. So this is a similar type of movement we just did to that toe rocking movement, but now you're getting a little bit more stretch, release up through the backs of the thighs as well. Settle here in your down dog, looking forward. We're stepping the left foot between the hands. And if it doesn't get all the way there, lower that right knee and help that left foot come forward with the left hand. We're all going to lower the back knee here. I'm placing a block under my right hand. This is just to create a little bit more space around my hips, spine, belly, thigh area. Left hand is going to make a big sweeping movement. So we inhale, sweep the arm out and up. Exhale, sweep it down and across. Inhale, sweep out, open up, gaze following that moving hand. Exhale, sweep it across. Option to keep the back knee down or lift it up and do the same thing. One more. So I'm going to lower my back knee. I'm finding both blocks here, one on either side of that front leg, sliding my back knee back a little bit. And you could be up on tinted fingers instead of the blocks if you don't have them. Shift the hips back, walk your hands back. So coming into a little bit of a hamstring stretch, or maybe a lot of one for you. Note that you want to keep that knee slightly bent, at least slightly bent, maybe more, so you stretch through the belly of the hamstring muscle, back of the thigh, as opposed to stretch at the back of the knee where the tendons are. Press into your hands and pull the chest forward so the round comes out of the back here. And we're going to add another version of a sciatic nerve glide. So you inhale, pull the top of the foot towards the shin, and then exhale, release it. And just do a few here. So this is hamstring stretch with that nerve glide technique. And you may not be able to pull that foot back very far. All right, that foot comes flat, walk the hands or those blocks forward. We're stepping it back into a plank position. Lower both knees. Keep your core tight. Toes are untucked. And you exhale, lower down to the ground. Once you're down, pull the shoulder blades towards the spine and the back waist to lift the head and chest. This is low cobra. And you could stay here if that feels better to your spine. Or you could make that a bigger back bend, but there's no reason to force it. Making our way to down dog, you could go through hands and knees or tuck your toes, pull the lower belly in to push the hips up and back into the down dog. Take a moment here, maybe a few more movements, shaking the head or pedaling the feet. You might still be, sometimes I'm so tight through the backs of my legs that my whole practice, I keep the knees bent in my down dog. Looking forward, it'll be the right foot between the hands, helping it get there. There's no rush. You know where we're going. Do the same thing on this side here. I'm going to put a block under my left hand, but it could be fingertips, loose fist, or palm flat if you have that space. Right hand, big sweeping movement. Inhale, sweep it out. Look towards the right. Exhale, sweep it across. Look towards the left. 3 more. Option would be to keep the back knee down, or you could lift that back knee. We'll all lower the back knee and find the 2 blocks here on either side of the front leg. And remember, you could be on fingertips here. I'm going to slide the back knee back just to create a little more space. Shift the hips back, walk the hands or those blocks back. Keep at least a slight bend in this knee, maybe more. Pressing into the hands to pull that chest forward. And then adding this ankle movement. Inhale, pull the top of the foot back. Exhale, release it. We'll do a few more here. So it should just be like a tug or a stretch down through the calf. Not so much a really pulling on that nerve and then not like sticking your finger in a socket kind of nervy sensation. Bend that front knee, walk the blocks or the hands forward, back knee up, and step the back foot to the front foot. We're coming into a forward fold. Now listen for your options, and these are the same reasons between child's and puppy pose. So one forward fold position is this ragdoll, knees a little bent. That's again to keep the stretch out of the hamstring tendons. Upper body draped over lower body, head hanging down. Now if you have a herniated disc, if you have osteoporosis in the spine, here's a version to keep the pressure out of the spine and the disc. It's feet wide, butt back, forearms on the thighs. So here, there's no compression going through the spine. In fact, you can even press through the arms and decompress the spine here. Either pose, you could sway a little forward, back, or side to side. If you're in that ragdoll version, you can also hold elbows, let the head hang down, shake it out like you're saying no or nodding yes. Bring your weight shift back to center, bend the knees a little bit, look forward, and strong legs rise up to stand. You could reach up or just take a couple of backward shoulder rolls once you come up here to that standing position. I'm going to move that blanket out of the way. And I'm going to turn to face you here, but you could stay facing the front of the mat, but step out wide. So your feet might be off the mat. And feet are wider than shoulders. You can come out a little wider. We're coming into goddess pose, which is basically a wide-legged squat position. So we're going to bend through the knees and the hips, and the spine is long, but we're hinging forward from the hips. So hinging right at the hip crease, bring the hands down to the thighs. We're adding this twist or rotation. So you're lowering one shoulder and look away from it. And then bring it back through center. We inhale, lengthen, press through the arms. Exhale, lower the other shoulder down towards the floor, look away from it. Inhale, bring it through center. And then we're alternating sides. And this is an area that gets to that mid and lower back, giving you a stretch. So if this is an area where you're tight, be gentle, be conservative. Feel a stretch that's more on the mild to moderate side of sensation of stretch and less into the, oh my God, this is so tight and I'm pushing really hard. It's actually more effective in the mild to moderate sensation range. Bring this back in through center, and we're going to use strong legs to come up to standing, walking the feet in, and come on up to the front of the mat if you've left that spot. Now I'm going to have my blocks here at the front. If you don't have blocks and you're really tight in your hamstrings, you may want to have a chair close by here. Oops. Starting at the front, take a medium to big step back with that left foot. So we're coming into a warrior one. This is a lunge position, but have the back heel down, back foot turned out a little bit. And to be protective of the lumbar spine and the sacroiliac joints here in the back of the pelvis, make sure your heels are about sitting bone distance apart. If you're more in a tightrope position, you end up kind of cranking and twisting through the sacroiliac joints. And if you have any instability or pain there, it can cause an injury. Front knee bent, tailbone lengthened towards the earth. The top of the head is reaching up here towards the sky. So you could keep your hands right here on your hips and just focus on that lengthening. So that length of the spine, we've got that transverse abdominis helping us out to decompress it. Muscles along the spine here working as well. Maybe the arms float up. So hands are over shoulders, palms face each other. See if you can release tension in the muscles that run between the neck and shoulders. Sometimes a wider hand position makes that a little easier. Taking a few breaths. So we can do all the core exercises we want, but if that doesn't translate into supporting our spine and the pelvis when we're in upright positions or functional positions where we need that support, it doesn't make any difference. So that's that lengthening of the spine, the decompress the vertebrae, the discs. We're going to release the hands down, straighten the front knee, step the back foot in a little bit closer. We're setting up for pyramid pose, which is typically like a hamstring style of stretch, and we might go there eventually, but I kind of combine a Romanian deadlift with this yoga pose, so we get some glute and hamstring activation here. So hands on the hips, getting tall, relax the shoulders, keep the length in the spine as you inhale, hinge forward from your hips, pause before the back begins to round. Might even have a slight bend in the front knee. And then squeeze the glutes, squeeze the buttocks to rise to upright. So we inhale, hinge forward, pausing before the back begins to round. Exhale, squeeze the buttocks to rise up. And we're going to do 2 or 3 more. I'm cueing squeeze the butt, but the hamstrings, the back of the thigh muscles are working here as well. It's just hard to imagine squeezing the hamstrings. So using that cue. 1 more, we inhale, hinge forward. If you're like, Laura, that felt great, I'm going to do more of those pyramid deadlifts, you could keep going. Or you could come into a little bit of a stretch. Hands could come down to the blocks or the chair. So you want your hands on the chair or the blocks if you have a herniated disc, osteoporosis in the spine, or if you're just really tight. So that can be helpful here. Tiny bend in that front knee. Maybe you're feeling okay with a stretch and you can let the torso kind of hang over that front leg. Take a few breaths. Bend the front knee, look forward, step the back foot to the front foot, and then rise on up to stand. So we're going to do that sequence on the other side. So this time it'll be the right foot stepping back into that warrior one. It doesn't have to be a deep stance. You can, but if you struggle to lengthen the tailbone towards the floor, shorten the stance. Heels lined up with the sitting bones, back foot turned out here. If it's the right foot, it's turned out to 2 o'clock-ish. Tailbone down, top of the head up. There's that core activation. You could keep your hands down, just focus on that lengthening of the spine, that sturdiness coming from the core, or the arms floating up, palms face each other. Release tension in the muscles that run between the shoulders and the neck. You might be getting a little hip flexor stretch on this back leg as well, if you're keeping that tailbone lengthening down. Remember, when those hip flexors are tight, they tend to pull in the pelvis or the lower back and manifest as low back pain. We're going to release the arms, straighten the front leg, step the back foot in a little closer as we set up for this pyramid pose. Hands on the hips, we get tall, get long, tailbone down, top of the head up. Keep the length in the spine. Inhale, hinging forward from your hips. Pause before the back begins to round. Exhale, squeeze the glutes and rise up. Inhale, hinging forward. Exhale, squeeze the glutes and rise up. We're going to do maybe 3 more here. Taking your time. It's the full length of the exhale to rise up. So you're slowing it down, which actually makes you engage the glutes and the hamstrings a little bit longer and with more control. And control is where strength is built. All right, we're going to hinge forward here. You could keep going if you like that, or this fold forward. It could be hands on the chair or hands on the block. Keeping that spine long if you have osteoporosis, herniated disc, or you're really tight in the hamstrings, or fold over that front leg. And you might have a tiny bend in that front knee, or a more generous one if you're tight. Take a few breaths here. Bend the front knee, look forward, back foot to the front foot. Come on up to stand using the legs, shoulders back and down. So we are coming into a quad stretch, and doing it in standing means that you're standing on one foot. So this is a quad stretch and a balance exercise. If you know you struggle with balance, I would recommend coming over to the wall or a steady piece of furniture. You can always choose to take the hand away and work on the balance more, or have the hand hovering or one finger on to focus on the balance here, as well as getting the quad stretch. You may not need the strap. This is just for those of you with tight quads or knees that don't bend well. So for the balance piece, bring one foot forward, spread those toes out, place them down, spread out, shift your weight onto that foot. Focus the gaze here on a non-moving spot. The visual focus is going to help you a lot with maintaining balance. We're reaching back to find the foot of the other leg here, the ankle, maybe the hem of your pants, or using the strap around the ankle. And then try to lengthen the kneecap towards the floor. So if the knee goes out to the side or forward, try to lengthen it straight down. At the same time, the crown of the head, the top of the head goes up. And that's going to get you starting to stretch some of the hip flexors, one of which is your longest quadriceps. There's another muscle that crosses over both the knee and the hip that we're stretching here. Take a couple more breaths. The quad stretch doesn't have to be a balance exercise. We're just getting a 2-for-1 in today. Letting that go, shake out your legs, and we'll do the other side. So bring that foot forward, spread the toes out, shift your weight onto it. Focus gaze on a non-moving spot, and we're reaching back for the quad stretch on the other side. Kneecap towards the earth, top of the head towards the sky. If this hurts the knee, you're pulling the heel in too close to the butt. If you cramp in the hamstring, the muscles on the back of the thigh, the opposing muscle group to the quads, you're pulling the heel too close to the butt. So you might need that strap to be able to achieve the quad stretch without hurting something else. We're going to release that foot, letting it go here. And we're coming down onto the mat again. And coming into some prone or belly down back bend positions. So we will be kind of pressing the hips and the pubic bones into the floor. Depending on your floor, if you're in a rug, it may not make a difference, but you might want some extra padding here under the hips. And this is just a thin layer of blanket, so there's not a lump under my belly or under my hips. But I would say, if you have arthritis in the lower back, radiologist report will usually say degenerative joint disease of the lumbar spine. These back bends may not feel great to you. You can modify it by putting a pillow under the low belly. So you start from a slightly flexed position, and when you lift, you're coming into more neutral as opposed to the back bend. You could substitute, come on your back and do bridge pose instead of these belly down ones. So this is a version of low cobra. It's sort of a combination of cobra and locust pose. We're going to have the hands under the shoulders, the elbows point towards your feet. The prep here is important for protecting the lumbar spine. Lengthen the tailbone towards your feet. Your pubic bone will press into the floor here, and you'll feel your low belly engage. Keep that this whole time. Shoulders pull back and down towards the back waist to lift the head and chest. So I'm pushing very little with the hands here. The neck is long. You could keep it at just lower body if that feels better, or raise the legs here. Keep the tailbone lengthening away from the head. Feet are up, but I'm going to bring them out to the sides and then bring them back into the middle, and then I'm lowering down. I'm going to smooth that out. Tailbone stays lengthened away from the head. Inhale, lift the head and chest, maybe the legs. Exhale, bring the feet out. Inhale, feet together. Exhale, lower. I'm going to do two more. Inhale, lift. Neck is long, so gaze is down and forward. Exhale, feet out. Inhale together. Exhale, lower. One more. Inhale, lift. Exhale, feet out. Inhale, them together. Exhale, lower, and rest. You can bring your arms forward, rest the head. Might feel good to bend the knees and rock the legs side to side. There was a lot going on in that one, especially as we moved the legs. If you were doing the leg lift, you might have felt your glutes working there, and certainly muscles all along the spine. But hopefully you weren't feeling pain in the lower back with that. Bringing the feet back down. So setting up for what I call triple relaxation position. And I'm coming up, even though we're coming onto our belly in a moment, because I'm going to use the blanket here. I'm folding it up, rolling it up into the fattest little roll I can make it. That is going to be underneath my shoulder, underneath one shoulder. Snuggling that in under the shoulder, close into the rib cage. So the opposite leg, I'm going to bend that knee and bring it out to the side in a frog leg position. So my inner knee, inner ankle are resting on the floor. The arm with the blanket roll could be out to the side or down by your side, whatever feels comfortable. The off arm and head in whatever position is comfortable. So you could be resting your cheek on the ground or hand under forehead for a neutral spine position. Get comfortable here. This is a position trying to relax 3 different sets of muscles. So you might need the knee higher or lower, the foot closer in or out. And then see what you can relax here. Start by lengthening out, slowing down the breath. Allowing the body just to release into the floor and into that prop under your shoulder. So this is another position where we're putting 3 different sets of muscles into a slackened position so they can relax. The roll under the shoulder, pushing that shoulder blade towards the spine so those muscles between the spine and shoulder blade can relax. Frog leg position relaxes the glute maximus we've been working today. Other hip rotators, piriformis is one of the main ones here. That's the one that lies on the sciatic nerve on top of it. Gets to relax. And because it's opposite shoulder and hip, side low back muscles on that frog leg side also getting to relax. When you're ready, straightening that leg and we're switching sides. So that blanket roll under the front of the other shoulder, snuggled in close to the ribs, opposite leg out to the side, frog leg position. Off arm and head, wherever it feels comfortable. It's worth getting, take a moment, reposition, lift the hips, put them back down, foot out or in, knee higher or lower, head turned a different way to get comfortable. Letting each exhale bring a little more tension release to the muscles in the back of the body. Sometimes when the muscles are tight, our instinct is to stretch them. And often if they're holding tension or if they're already being pulled taut in a stretch, we need to get them to relax. And that will relieve some of the pain and the tension on the muscles. When you're ready, straightening the leg, moving that blanket out from underneath you here, and then coming onto your back. So just rolling over. Knees bent and the feet flat here. Cross one ankle over the other knee and pause. We're going for this reclined pigeon or figure four stretch. This may be enough, or depending on what's happening at your hip joint, you may not go further than this. Or you could pull the legs towards you, reach between the thighs to hold onto the back of the leg. And we're looking for that mild to moderate sensation of stretch in the buttocks, outer hip of that crossed over leg. If you're feeling something that's closer to pain or pinch on the front of the hip, you pull the leg in too close, you could put the strap behind the thigh so that basically makes your arms longer so you don't have to pull in as far. Or put the foot up on block or two, or foot on the edge of the chair to kind of wedge yourself into that stretched position. I like doing that frog leg position, relaxing the back of the hip, and then coming into the stretch. That's a good sequence. So the stretch itself might actually be more effective, or you could stretch a little further without it feeling so intense. When you're ready, switching sides, and it may be different. My right hip is definitely tighter. I have less range of motion here. So I just have to accommodate. Check in with the neck and shoulders and jaw. Sometimes we have a tendency to tighten up, tense up there. Letting that go. Stretching that glute maximus here, but also piriformis. So if you have some of the sciatica problems, that relaxation position, the frog leg, gentle stretching here is a good place to start. Releasing this, lowering the feet down to the floor. So we're coming into supported bridge, into a hip flexor stretch. I'm going to use my block. You could be using a foam roller instead, or a folded, rolled blanket. Maybe it's still in that same position from the triple relaxation, lifting the hips and sliding that prop under the sacrum, so that area above the fleshy part of the butt, but below the low back. And just pause here for a moment. Hips are higher than your shoulders. So it's like we position the spine sort of in a incline table. If you've ever used one of those or seen one of those used for people with back problems or herniated discs. So spine parallel to the earth, we take the compressive forces off of it, hips lifted, we're actually pulling, gravity's actually creating that space between the vertebrae here. I almost think of it like if you've ever opened a bendy straw, you take it out of the package and you have to pull it apart before you can bend it. This is that kind of like creating space in between. You could stay here, feel pretty good, or come into a hip flexor stretch. You'd pull one knee in, straighten the other leg, heel resting down. The bent leg, I'm not pulling it in hard. It's really just position so my low back doesn't arch. And I'm moving that knee out to the side just a little. Here, feeling some stretch on the front of the hip and thigh. Maybe, or maybe it's just a sense of openness there. Slow that breath down. So as I was saying before, hip flexors do the job of lifting the thigh. But if they are tight, if they are holding tension, they don't involuntarily lift your thigh up. They're going to pull from the spinal end and start to compress the joints of the lumbar spine. So often a hip flexor tension and tightness will manifest as back pain, low back pain. Switching legs. Knee pulled in, maybe gently pull it out to the side. Relax the neck, shoulders, jaw. I taught another yoga class today about basically reversing desk posture or counteracting it. One of the stretches we did, the hip flexors. So they shorten when you stay in a seated position for a long period. All right, we're going to bring both feet down, lift the hips up and take that prop out from underneath, lowering your hips back down. We'll straighten one leg, pull the other knee in towards you just gently. We're coming into a spinal twist. So the opposite arm is going to hold the knee and you're pulling that leg across. Other arm comes out to the side. Maybe that knee comes all the way over. Maybe you're a little tight in the hip or the back. You can always slide a block underneath here, underneath the knee, the calf, so it has something to rest into. Turn the head away from the legs. So for those of you who sweep, you might be feeling this differently on left and right side based on which side the aura is on. And today we're going to be spending relatively equal time side to side. But if you know that's your tighter side, you might be spending a little more time on it. When you're ready, roll onto your back, knees to chest again, gently rocking. Keep the other knee pulled in while you straighten the other leg and pull it across. Maybe it hangs out, maybe it rests on the floor, maybe you slide some prop underneath. Arms out, head turned away. Purposeful, lengthened breath. You're ready. Coming onto your back. Feet coming down or pull the knees into your chest. Maybe you come into a happy baby. I'm demonstrating the relaxed, I call this the relaxed version of happy baby. So holding the backs of the thighs, my knees are out wider than my ribs, gently rocking here side to side. if it feels good to come into a little bit more stretch, a little more hip bend, you might hold ankles or you might hold soles of the feet. But if you notice you tend to kind of strain or lift that head up to grab, then hold further down on the leg or further up, closer to the hips, I should say, because it depends on your orientation of your body. Which means up and down, gently rocking. And then deciding if there's something you'd like to do before Shavasana, before relaxation. There might be something else you do for your neck or your knees or your shoulders that would feel good. Maybe you have an inversion practice in your yoga practice you'd like to add in. Maybe there's, not a specific yoga pose, but a stretch that would feel good to you. Add that in here. And then thinking about setting yourself up for relaxation for Shavasana. I'm going to come back into that legs on the chair position, so sort of bookending the practice with that. But you might choose to come into legs at the wall, maybe have a roll under the spine to stretch the chest. Maybe you're just flat on the floor here. Or you could be on your belly, coming to that triple relaxation if that felt good. I'm choosing this hip flexor relaxation position again. And, we're here for about 5 minutes. Often if I have that fatigue or achiness or pain in my lower back, I will come into this position for like 15 or 20 minutes. I might bring a book or listen to a podcast and just really let it rest. It's a very restorative position, a great recovery position if you've done a lot of lower body work or heavy distance or fast intervals or something like that where your legs are fatigued. I'm just placing that folded blanket on my low belly, the hips, so I can feel a little grounded, that connection to the earth. Eyes closed or open, whatever feels natural. And then we'll use this breath to transition to rest. Take an inhale through the nose. Open the mouth and let out a sigh. You could do that again. Let the breath go. So no longer dictating or being conscious of how we're breathing. The body knows how to breathe instinctively, automatically. We're just being here. We're not trying to accomplish anything or feel something specific or stretch or engage. We're just resting for the next few minutes. And the lovely things about virtual yoga, you're not in a yoga studio. You don't have to get up and leave at the end of the practice. So if you'd like to stay here for longer, please feel free. If you are ready to move on, start to deepen the breath. Invite some gentle movements like wiggling the fingers and toes, circling wrists and ankles. If you're on your back, maybe a full body stretch where you inhale, reach overhead and lengthen. Exhale, relax. From the back, bend the knees and roll to your side and just pause for a moment in fetal pose. Taking this opportunity to appreciate your body, your breath, your health, your yoga practice. Being gentle, press up to a seated position. Thank you all for being here, sharing your practice and energy. The light in me honors the light in each of you. Namaste. Thank you. Please let me know if you have any questions. I can stay and answer them.
Thank you, Laura.